guys, so today we are doing a requested video all about the do's and don'ts of medication administration.
Yes. So you definitely want to make sure you know the 5 rights of medication administration. Well, there are actually 10 rights now, so just make sure you're familiar with all 10 of the rights of medication administration.
Yes, for sure. And knowing those rights will help you every time you give medication to a patient to avoid error. So first things first, you want to make sure you always scan the action. Girl, what is it? Let me see if it's in there. Like, make sure it doesn't go to my ear. So first thing you want to do is make sure that you are scanning the actual patient that you're going to be giving medication to, because you want to verify that it's the correct person, and you can verify with their name and their birthday, and just scanning, do the process.
Yes, and you want to just check the medication, make sure it's the right medication, the right dose, make sure you're giving it at the proper time, especially with antibiotics. Make sure that you're not giving it too early or too late. Try to keep it on the correct timing.
Yeah, for sure. And you want to make sure that you have like the route correct. Just because something is in the syringe, you don't want to assume that it's IV. It may be an oral medication, and just because something looks like it's a pill doesn't mean that it's going to go in the mouth. So you definitely want to make sure you double check on things like that as well.
Educate the patient on all of the medications. I know some patients are like, oh honey, I just take whatever the doctor gives me. You don't have to go through it. But it's really important to go through the medication so that the patient is aware of the medication. They know the importance, and they can make sure that they take it further down the line.
So you want to make sure you don't just take a patient's word for it when they say, oh, I take this all the time, because they're in the hospital, they're in like not their best state. They may be confused, you don't know. So you can go in and say, I'm going to give you this hydrolysis, and they cut you off. They're like, oh, I take that every day. And then you just go, oh, okay, well, here you go. And you're saying, I'm giving you hydrolazine. They thought you were saying hydroxyzine, and now they're confused. So you just want to make sure, even if they're like, oh, I know what it is. Oh, I know, I understand that you know, but it's just our protocol here to tell you again. So just verifying that you know that this medication is going to lower your blood pressure and may cause some dizziness. Always want to give them side effects as well, so that they know the important things about the medication. So a lot of times that will also help you to prevent falls, because if you say, I'm going to give you this medication, it may potentially make you dizzy. It may make your blood pressure get a bit low because you've been really high and the doctor's being like aggressive on handling it. So sometimes they're like, oh, well, let me not get up,
When administering medications, you want to make sure you think critically in every situation. Do not blindly scan the patient, scan the med, and give the med. You want to make sure all the meds are appropriate for the patient at that time, especially like say with the blood pressure medication. You want to make sure that the patient isn't hypotensive, which is low blood pressure, just because of the reason they're in the hospital at the time. So with those medications, make sure there are parameters set by the doctor, which means do not give this medication if the blood pressure is below 110/60, or do not give this medication if the heart rate is below 60. So you want to make sure that those parameters are in place and that the patient meets the parameters. And if there aren't parameters in place, make sure you get an order for the parameters.
Yes, and you definitely want to always use your critical thinking also in other aspects. Like for instance, if you know your patient has been NPO, they haven't had anything by mouth since midnight, you're not going to give them an insulin that's going to like shoot their blood sugar down right before surgery. Or if you have a patient that is going to go for dialysis, you don't want to give them all of their morning blood pressure medications and then cause them to bottom out because the medications are in their system when they're getting like fluid removed. So you just want to make sure that you always use your critical thinking. You can always double check. You definitely don't want to give a blood thinner right before surgery, because you don't want to increase bleeding. So if you see Lovenox is scheduled for 9 a.m. and you know the patient is NPO for surgery, and you know that they are going to be going any minute now, don't give the Lovenox. Definitely hold it. If the doctor doesn't have an automatic hold on it, it is up to you as the nurse to use your judgment. If you have a question, ask someone. Ask another nurse, hey, what do you think about this? Ask the charge nurse. But just from basic nursing school knowledge, you should know not to give a blood thinner if they're going for surgery.
Yes, exactly. So all of these are just ways to keep the patient safe and to just keep you safe as well. Keep your license safe.
Yes. So you definitely want to double check for allergies, because sometimes maybe a patient was like not completely with it when they were doing their admission questions, and there's an allergy that was missed. So you want to definitely be sure again that that's when the importance of telling the patient exactly what you're giving them comes in handy, because don't just automatically assume they're going to take everything that the doctor has given them. Remember, they have a right to refuse. So the patient may say, oh, I had like 4 or 5 loose bowels yesterday, I don't want my Colace today, and so they have that right. You can educate them, oh, well, the doctor really encourages you, to take your Colace to prevent constipation. But then again, also use your nursing judgment. They're not constipated if they had 5 loose stools yesterday. So don't pressure them to take the medication. Just mention to the doctor, I held her colace, she reported multiple loose stools yesterday, and maybe he might want to adjust the dose, or he may say, okay, just do it at nighttime. You know, you never know, but you definitely want to communicate with the patient, and you definitely want to use your critical thinking, and you definitely want to always explain to the patient and let them know what's going on too.
Yes, absolutely, absolutely. And after all of that, you want to reassess the patient and evaluate the patient to make sure the medications that you gave them are effective, and if they aren't, there's something else that you need to get ordered for the patient.
Yes, for sure. And I never give a medication, especially one of the medications that are used to like alter vital signs. I never ever give one without checking immediately before.
Exactly.
So if I'm giving you something to lower your blood pressure, you bet your bottom dollar I'm going to check it. Because maybe when I called the doctor to get the medicine like an hour ago, he was in surgery or busy or whatever. If I called him an hour ago and he just put the order in, I'm not gonna just blindly walk in and give it to you because you may be within normal limits now.
Right.
It's nice to have it for later if you spike again. But I mean, you know, especially if you put parameters in there, do not give unless the blood pressure is above 160.
Yes.
Maybe now you've come down to 142. Still high, but not high enough for him to want to give you that medication. So it's not up to me, it's not up to the nurse, it's out of my scope of practice to make that decision. So you definitely want to make sure that everything that you do, you're documenting. Okay, you called me for this blood pressure medication, she never got it. Why? Because her blood pressure went down to 142 by the time you called me back. You can slide that in there. Her blood pressure went back to 142 by the time you called me back, and your parameters specifically states don't give unless it's over 160. Smile. Notice like when you scan a medication, if you're only supposed to give 1 and you scan 2, the computer will be like, whoa,
you get to,
whoa, buddy,
what are you doing?
Slow down there. You know, so like that's nice, because then like if you did that, you can kind of check yourself like, oh, like I scanned 2 by mistake, and you know the computer. And of course the hospital keeps track of stuff like that. So you definitely want to be careful, because you don't want it to be like every time you go in the patient's room, it's like, whoa, buddy. Then they're gonna be like, okay, maybe we need to do some education here.
Exactly.
Yeah. So,
and it's okay if you don't know what a medication is. So, but you want to make sure that you educate yourself on the medication before going into the patient for 2 reasons. 1, you want to be able to educate the patient, and 2, you want to make sure that medication is appropriate for the patient at the time. So definitely check that little micromedics.
Yeah, you can check micromedics. I don't know if everyone has micromedics, but there should be a lot of resources for you to use
check the medication.
within your hospital database where you can check out the medications. But there's nothing scarier than going in, giving a patient a new medication, and they're like, what is it? And you're like, I don't know. You tell me. Like, imagine how scary that would be.
Yeah,
and then that like questions your competence. The patient is then like, they're feeling unsure of you because they're like, you don't know what it is, and you're gonna give it to me.
Yeah, they're looking to you for answers, and you're not giving them the
answers. Always, it's definitely okay to always be educating yourself. It's a learning, like nursing is, I feel like we're constantly learning new things. So if I get a med I've never heard of, I'm like, what is that? I go and I check the drug book, or I check the resources, and I look at it and see what it is. And that way when my patient asks me, what is that? I kind of smile, because I know that I can answer the question. I'm like, oh, it's so-and-so. It's for your so-and-so. You can kind of do that as well. You don't have to have all the answers. But then I always, at that moment, I'm like, but you can ask the doctor when he comes.
Exactly.
You can like divert to the person that should be receiving those types of questions. I never give out information that I don't know about. Because again, I feel like it's not my place. So before I tell the patient it's definitely for this, I would tell them what I do know that it's commonly used for this and this. So it could be one of those things, but just to be sure, when the physician comes around, we can ask him together why you are on this medication, if it's something that's like not common.
So also be careful with medication interactions, especially with IV medication. So that's something else to be mindful of.
Yeah, for sure. And you definitely want to pay attention, especially to those medications that like should be refrigerated, things that say don't put it in, like don't expose to light. There are some antibiotics like that. So when you go in to give your medication, always pay attention to any little special alerts that pop up. So like if it says do not expose to direct light, then you're not going to have the IV pole right under the patient's like light, right? Because that can ruin the medication, it can change it, it can make it unstable, anything. So you definitely want to make sure that that's pulled out, and you know, you don't have like lights blasting right on that medication. Or if you know, you definitely always if you're giving insulin, check the expiration on it. Because you know, those insulin bottles, like sometimes they go out and they don't necessarily get replaced. So it's always nice to be proactive and double check the insulin if you're going to give it to someone, because if their blood sugar is high and you give them expired insulin, like You know, what's the point? So that is med error at that point. So what you want to do is try and prevent med errors as much as you can. Thank God I've never had one.
Yeah.
Neither has she. But that just comes from, again, being very diligent, being very careful, and making sure that when you go in, you're like fully focused and you know what you're doing. If you're in the middle of giving meds and maybe the patient's being like very chatty or something, I usually will be like, oh, Miss Jones, you're so sweet. Let me just get your meds done first, and then we can talk a little bit. You know, don't try and like hold a conversation and scan stuff and do things, because that's how you make errors. I wouldn't recommend that even for someone that's like been a nurse for a long time.
Yeah,
like I said, I still don't do it. Yeah, especially if I'm drawing up something where I have to measure it, and she's like, oh, my grandson's so sweet, take a look at him. I'm like, okay, Miss Jones, just a minute. You know, like, I want to pay attention to what I'm doing. I'm not gonna go, oh, his little cheeks. Like, no, that's not safe. So you definitely want to make sure that you have 100% like focus, and you want to make sure that you're paying attention and know what you gave, so that when the doctor comes around and he's like, did she get her Lasix this morning? Yes, sir. 40 milligrams, you know, so you're on it. That doesn't necessarily mean that you have to memorize everything you gave everyone, but at least know, like, if you know your patients and what's going on with them, then when he asks, if you went over the medication with the patient, it should pop back into your head. So you're like, oh yeah, because I remember telling her about, you know, she may have increased urination with that one.
Those are our do's and don'ts of medication administration.